The purpose of today's symposium was to kickstart the debate about the future of universal healthcare in Australia. There's been some commentary and some debate around the edges about the future of Medicare. I wanted to bring the right people together in the right room with expertise in the health system, public policy and in politics to say, well, let's talk about it. Let's have an informed debate rather than a hysterical one with people making strong statements that aren't backed up.
So a key element in what we should be looking at today and what we should consider in terms of policy change is in areas like palliative care, Aboriginal and Torres Strait Islanders of course, refugees and people from non-English speaking backgrounds as groups tend to be more vulnerable, tend to need more expenditure, and we haven't been putting it there, and I think that requires a shift in our policy levers.
Well, one problem, if that is the central problem, this issue of coordination, which runs right across, it's not just chronic care, save the aged, but it's mental health, areas like eating disorders, all of these problems crop up. And the issues are, how do we bring together the different parts of the system that don't work together at the moment?
Part of it is about addressing efficiency. The health costs are increasing quite rapidly, and it left unchecked, they'll consume a greater and greater proportion of gross domestic product. But what I think we need to do is to try and bend that cost curve. So rather than increasing to 12 or whatever % of GDP in 2033, we try and keep it at somewhere between 9 and 10 and 10 and 10.5% of GDP through improvements in efficiency, through improvements in care organisation.
I think one of the problems with the universal health scheme that we have at the moment is that it's built on a model of administration and delivery that's really of the last century. I think that people need to have more accountability for sustaining and using the health system, and we need competition in the system to drive efficiency, and it's the combination of choice and engagement of consumers driving efficiency that will be necessary for the future.
In discussing this, you need to separate two things, because I think these sometimes get confused in people's minds. One is, will we provide a full range of health services? The separate question is, how will we pay for that? I think that's a slightly different question, and I think in relation to that, it is likely that we will see some variations to the current funding mechanism, but we will still have a universal healthcare system.
I think it's unrealistic to expect governments to continue to be able to fund healthcare through the existing Medicare system. What I think we need to do is revise the way we currently use health funding to pay for healthcare, not just now, but in the future as well. And that means shifting to a more savings-based approach, whereby people are encouraged to use health savings accounts to save up and pay for healthcare over time, and combine that with an insurance system that provides cover for chronic and catastrophic conditions. I think this is a more rational and sustainable way to fund healthcare, and it will enable people to get access to the services they need, but also take more personal responsibility.
I accept that there may be a call for people to contribute more out of their own pocket. But that has to be done in an equitable way. It has to be done according to people's income. The rich have to pay more than the poor for that.
Medicare is a political sacred cow. Politicians are very reluctant to talk about any fundamental changes to the system or any of the fundamental challenges to the system, and sustainability is the #1 challenge. I think it's really positive that the Deeble Institute has put this issue up for public discussion and has asked a diverse range of speakers to come and address the topic. It's the sort of public debate we need to encourage politicians to be prepared to get out there and talk about it as well, because if we don't make the changes that we need now, there'll be long-term consequences both for the economy, both for the welfare of Australians, and we need to start having a serious discussion. So I applaud the Deeble Institute for leading the way.
I think that one of the really great things today is to be able to take a historical perspective in order to understand where we are today. I think quite often we forget history and we repeat history at our own peril. So I think that's been absolutely fabulous. I think the other dimension is to really say, it's not just about the money, it's about the outcomes, it's about how we do better with the money. So I think it's so easy for debates to simply focus on, is it private, is it public? But I think we've really gone beyond that today in a much more sophisticated way.